moving on to swallowing then. These purple lines, this is showing your brain passes messages along your nerves to all these different parts that are involved in swallowing. So your brain sends messages to the nerves that control the movement of your jaw, so the muscles of your mouth that let you chew. There's different nerves that control the movements of your tongue. So this green bit there is food. Normally, once the food has been chewed up, formed into a bolus, it passes the soft palate at the top of the mouth, and then can you see down here, can you see how you've got two pipes? You've got two tubes, haven't you? So the one at the front is your trachea, that's your windpipe. So from your nose, from your mouth, it goes down the back and you've got two pipes. This one goes down to your lungs, for your breathing. This one at the back is the esophagus that goes down to your stomach. And what you have, your larynx has to close when the food goes down to stop the food from going down the wrong way. So you've got this thing called an epiglottis. It's a little flap, like a trapdoor. And you have a swallowing reflex, so you don't have to think about it, do you? As you swallow, down your throat, past the soft palate, this little epiglottis will shut off your windpipe, cover that up so that the food just goes down the back into your stomach. Fantastic, everything's fine. Now, if somebody has had a stroke and it's affected either the part of the brain that controls movement of the mouth, so you're chewing and your tongue, they can have problems with swallowing because all the swallowing reflex, all the normal swallowing, if you haven't got a strong swallow, you can have problems, you can end up choking because you've got weakened muscles. Also, if this little part isn't working, so if the epiglottis is not shutting off properly, if that little reflex isn't working, the message from your brain isn't getting to that part, then what can happen is that your food and your drink will start to go down the wrong way, down the front and into your trachea and then into your lungs. Now, if you think about it, sometimes when you have food left over on your plate and you scrape it off into the bin, you know when food starts to rot, it doesn't take long for it to rot and smell and go off. Think of that food in your lungs. Obviously, if it goes into your stomach, the good bit gets taken out and the rubbish gets eliminated. If it's in your lungs, it's got nowhere to go, has it? So it's just festering there and rotting. And what that leads to is chest infections and something called aspiration pneumonia, which is nasty and can lead to death, basically. People can die from that. So it's really serious, and especially with sort of an elderly population as well, who sometimes aren't as physically fit, chest infections can be really quite serious, can't they? So when somebody comes into the care home who's had a stroke, often if they've been assessed on an acute stroke ward, they should have been seen by a speech and language therapist. And often they'll come and they'll be on a particular diet. So people have, the thick and easy, the thickener put in. And often people don't like it because it makes the tea look like sludge, doesn't it? It's not pleasant. And you might think, if you don't understand why it's important, you might think, oh, it's mean, no one's looking, I'll just let them have a normal cup of tea. It is so dangerous. If somebody hasn't got the swallow, it's so dangerous if you don't follow the advice of a speech and language therapist. So sometimes people can cope on a pureed diet or a mashed up diet. Sometimes it needs to be syrup consistency, and it depends on exactly how good their swallow is and exactly where the problem is. So the speech and language therapist is the expert in that, and they will have given the advice. Now, sometimes people come into a care home from their own home. So maybe they had a stroke, were able to go home, and then later on they deteriorate and come to live in a care home. They might not have been assessed by a speech and language therapist in a long time. And like most things, people's swallow can deteriorate. So if you notice somebody when they're having their meals is coughing and spluttering a lot, they seem like they can't cope with the food and the drink. Coughing and spluttering and drooling is an indication that someone has a problem with their swallowing. And they need to be assessed by a speech and language therapist. You know these residents better than anyone, don't you? Better than the GP, definitely better than the GP. So you see changes in people, don't you? And you will be able to pick up if someone's having difficulty at mealtime. So you can save somebody's life. If you tell your nurse, if you tell we need to get the GP to make a referral to speech and language therapy, you're often saving somebody's life, or at least making them more comfortable and preventing them from having chest infections and problems. So about a third of people will have some sort of communication problem after their stroke. A lot of people have communication problems. Sometimes it's called aphasia. You can hear the medical staff talking about it. And either people have a problem with understanding, so getting the message in, and that's called receptive aphasia, or they have difficulty with expressing themselves and getting their message out, and that's expressive aphasia. Some people have both, which is obviously really, really unfortunate and really difficult for them and other people to try and maintain conversations. So, some people will also have problems that are due to the muscles involved in speech production. So like with swallow, sometimes it's because they can't move the mouth, and these people often sound like they've got slurred speech, so people might think they sound drunk or something. That's dysarthria. And of course, if you have people who also have memory problems after their stroke and difficulty with concentration, then that can affect communication as well. If you're trying to have a conversation and the person's forgotten what you've said a few minutes after you've said it. So there's lots of reasons, really, why people can have problems with communication after stroke. So if you have receptive aphasia, if you have problems understanding what people are saying to you, this is what it's like. You might as well be speaking French, German, Spanish, Welsh. The person cannot understand what you are saying to them. It makes no sense. With receptive aphasia, sometimes the problem is with spoken language, but sometimes it's with written word. So sometimes people can understand when you're talking to them, but they can't understand when it's written. And sometimes they can understand written, but not when it's spoken. This is exactly the same information, but we've highlighted keywords and put bullet points to try and pick out the important bits. So we still don't really understand it, but we've got a couple of words maybe just by highlighting the key points. Now, it's the same information again, but this time we've added pictures to try and help illustrate the point. So what it actually says, and this is me relying on Google Translator, there are many factors such as your diet, alcohol intake, smoking and leading a lazy or sedentary lifestyle that increase your risk of having a stroke. But do you see how by breaking the information down, how we use pictures and you can try and help get the message across to people? If someone has an expressive aphasia, you're able to completely understand what's going on around you. You understand what people say, but you can't speak. You can't get your message out. How frustrating must that be? To be in a world where you understand everything that's going on around you, but you can't give your opinion, you can't ask for something yourself. How might you get your message across? What sort of things might you do? Yeah, you might write. If they've also got a weakness and they're not able to walk about freely, mobilise independently, you would have to make sure that pens and paper are within reach, wouldn't you? Pictures, yeah, great.